Hello, Stanley Porter here again with another answer to a fitness question. I was asked, I think it was Julie, about knee pain. What exercises can I do if I have knee pain, and how many days a week should I work my legs? I'll give you the simple answer because it's much more complicated than this, but the simple answer is if you have knee pain, I would stay away from anything where you jumping, I would stay away from any running, anything that's going to apply more pressure to your knee area. I would not do it until I figure out what's going on with your knee. So you can probably get away with a variety of seated exercises, even standing in a slight squat position and doing battle ropes where you're not shifting your knees should be fine. You can also probably get away with the adductor and abductor machines where you sit down and you put your legs in these stirrups, and then you can move your legs out and in, out and in. And those will work your inner and outer thighs. You can get away with those. And stretching, I can't emphasize that enough because you have muscles around your knee that need to be strengthened, but also need to be kind of prehabbed or rehabbed through stretching. So you want to stretch out your hamstrings, stretch out your quads in the front of your leg, all right? And keep your calves nice and loose. So I'm not gonna get into how to stretch those areas, but just know that stretching is very helpful for your knee health. Now let's get into why it's a little bit more complicated with the knees. So you gotta ask yourself, is it a skeletal issue? So if I use my finger as a representation of the knee and this represents the kneecap, did you have an accident where you fractured this, or something happened with the bone here? Or is it ligament related? So you have this part of your leg, imagine this is the knee, right? And this is your foot. So here's the knee. Now you got the thigh, there's a bone there, and you have this part of your leg where there's another bone. Now what connects them to the knee? Ligaments, all right? So those ligaments are wrapped around and connecting. Now sometimes when we're shifting and moving back and forth, there might be a tear or there could be some strain on those ligaments around the knee joint, and that can cause pain with your knee. Also, if there's kind of a muscle imbalance, so think of this as your knee again. I'm moving my knee back and forth, my little finger knee. If you have tight quad muscles in the front of your leg or in the back of your leg, the hamstrings, if you have tight hamstrings or quads, that can also produce some pain in the knee. So you really want to stretch out those muscles and strengthen them as well. A common issue that I see in gyms has to do with foot placement as it relates to knee health. So let me show you what I mean by that. So when people are squatting, sometimes they're leaned forward and their knee is coming beyond their front toe. So imagine somebody is squatting. This is a squat bar right here on their shoulders, and they're going up and down squatting, and all this weight is coming down onto the knee. That's not good. Proper form is to keep your foot flat, not forward on the toe, and bring your hips back almost like you're sitting in a chair. So if you're squatting, try to practice that form without heavy weight. And so what happens there is the weight here that was coming down, crashing down onto the knee, actually is shifting away from the knee now, all right? Because the knee is not really that, it's not hyperextended. So the weight now is shifting to the heel. So you want to be heel dominant when you're squatting. This could be, so that's a squat, and I'm sitting back like I'm going to sit in a chair, and I'm pushing up from my heel, not my toe. Same thing if you're lunging. So this person could be lunging, right? Same thing. If the front foot is flat and they're pushing up off the heel, it protects the knee. Finally, with foot placement, if you're doing a leg press or a squat, it's okay if you don't have knee problem to do a close stance squat or leg press, but it does put more pressure on the knees. If you've got knee pain, I suggest feet shoulder width apart, okay? If you're squatting or if you're doing a leg press, and that should take some pressure off the knees. As you can see, it's a very involved issue, but I hope this was a helpful kind of introduction to conversations around knee pain.